Well, good morning, and thanks everyone for being here today in this warm July day as we gather to discuss the state of American families 250 years since our great American experiment began. Earlier this month, we celebrated America's 250th birthday as a nation built on the idea that all people are created equal with the gift of inalienable rights of life, liberty, and the pursuit of happiness, and the principle that governments are created by, of, and for the people to secure those rights. But since our nation's founding, our collective struggle has been ensuring that these ideals apply to everyone, not only a privileged few. Today, American families, the backbone of our country, face real challenges when it comes to affording a home, childcare, college, healthcare, retirements, just about everything else. As the price of everything from gas to groceries has skyrocketed, millions are now forced to make very difficult and impossible choices between maintaining access to healthcare, paying their rent or mortgage, putting food on the table, keeping the lights on, and more. Actions by the Trump administration and congressional Republicans have only exacerbated this struggle. They've needlessly separated families. They've slashed budgets with the largest cuts to health care and food assistance in American history through their big ugly law, H.R. 1, which they call the One Big Beautiful Bill. All of these cuts were to fund tax breaks for billionaires, causing more kids to go hungry and more families to go without the preventative care they need to stay healthy. Republicans further enshrined higher health care costs by letting the enhanced premium tax credits under the Affordable Care Act expire, forcing even more people to forego care unless they pay for it out of pocket. And they've led federal rollbacks that threaten the well-being of families nationwide, all while putting forth policies that strengthen some families to the exclusion of others. In January of this year, the Heritage Foundation, Project 2025, launched their Saving America by Saving the Family report. That report promotes an exclusionary definition of family, frames abortion and shifting gender norms as threat to family stability, and more. It represents a massive step backwards in ensuring that everyone, regardless of zip code or background, has the tools they need to start, raise, and support a family. All families in this country deserve more support, and I propose a better path to provide it. I envision an America in which everyone is free to plan when, whether, and how to become a parent, and that they can do so free from the fear that a pregnancy will be too complicated or deadly. I envision a future where everyone is free to work and care for their loved ones without going bankrupt or living paycheck to paycheck. That's why, as we celebrated 250 years of American families, I launched an alternative framework in collaboration with Third Way and other partners. I'm going to pause just a minute. The All-American Family Agenda is a set of policy priorities to ensure that family life in America is accessible and affordable to everyone by supporting family formation and strengthening family well-being. This agenda answers a pivotal question that is posed by the Heritage Foundation's report. How do we combat declining birth rates and promote family well-being? But my agenda does so in a way that supports all kinds of families without engaging in the culture wars that define the Heritage Foundation's plan. To be clear, my agenda cannot become law until we reverse the cuts made in the big ugly law. But at a time when Republicans in Congress and in the White House are wreaking havoc, we have to build our own theory of power by delivering clear objectives to the American people as well as ways to achieve these goals. The All-American Family Agenda does that and more. It proposes expanding access to reproductive health and contraception, protecting in vitro fertilization and fertility treatments, improving mental, maternal, and infant health, strengthening adoption and kinship care programs, making child care more affordable, creating a national family and medical leave program, expanding housing affordability, lowering prescription drug costs, supporting unpaid family caregivers, and more. I am incredibly grateful for the endorsing organizations and the storytellers that are here today who can speak more about the specifics of the vision laid out in this agenda. And I'd like to now hand it over to a trusted partner throughout the creation of this agenda, Gabby Hartney from Third Way.
Thank you so much. Today, too many people are asking whether they can afford to start a family, whether they can find the care they need, and whether they can keep up with the cost of raising a family. These are not abstract policy questions. They are the worries people carry every day. Family should be the source of strength, not stress. Like many of you, I have friends who worry they won't be able to have children when they're ready. I have loved ones who have needed emergency miscarriage care to save their lives, and I've worried about the safety of friends as they've given birth. No one should have to face these fears alone. At Third Way, we believe people deserve health coverage they can afford, care they can access, and a system they can use. One that puts patients first and delivers safe, high-quality care. But supporting families also requires more than an insurance card. It means addressing the financial, social, and structural barriers that make it harder for people to start a family, raise children, and build a secure life. That is why the All-American Family Agenda matters. Congresswoman McClellan has put forward a better vision, one where every person has the freedom and support to build a family if, how, and when they choose. One where families can stay healthy and financially secure. This agenda reflects a modern, inclusive vision of family. It recognizes that there is no single model of an American family. Families are formed in different ways, but every family deserves dignity, opportunity, and a fair chance to build a secure future. This agenda protects the freedom to make deeply personal decisions without politicians standing in the way. Third Way is proud to support the All-American Family Agenda, and we are grateful to Congresswoman McClellan for her leadership on maternal health, economic security, and policies that help families thrive. As America marks its 250th anniversary, the All-American Family Agenda reminds us that every family deserves freedom, opportunity, and support to thrive. And now I'm excited to pass it off to Families Forward Virginia. Thank you.
Good morning. I'm Jamia Crockett, the CEO of Families Forward Virginia. And before I ever held this title, I was simply someone who believed that every child deserves the opportunity to grow up in a family and a community where they can flourish. That's why I love this work, because at its heart, this work is about and for the. I've had the privilege of listening to providers, community leaders. I've had the privilege of listening to providers, community leaders, and families across the Commonwealth of Virginia. So whether we're in Southwest Virginia, Hampton Roads, Richmond, Virginia, or even Northern Virginia, they're all sharing remarkably similar stories. Families are working incredibly hard, yet they're navigating housing instability, transportation barriers, affordable child care shortages, maternal mental health concerns, and rising costs, because let's be honest, the cost of eggs is creeping towards $12, all at the same time. Families don't experience life through separate programs, funding streams, or government agencies. They experience life as one journey. We, as we live our life, are experiencing that in one journey. So let's take a picture. Housing affects health, mental health affects parenting, childcare affects employment, transportation affects access to care. Supporting families means recognizing how connected these challenges really are. That's why I find the vision behind the All-American Family Agenda so inspiring and then also encouraging. It reflects an important evolution in how we think about strengthening families. At Families for Virginia, we believe every family deserves more than access to individual services. They deserve the opportunity to build a healthy, stable future through quality health care, trusted parenting education, affordable child care, strong family supports, and trusted relationships that help them navigate life's hardest seasons. Families deserve a connected system of support that grows with them. By intentionally aligning investments in maternal health, parenting education, affordable child care, family support, and economic stability, we can create the conditions where children flourish, parents are empowered, and communities become stronger for generations to come. Because supporting children begins by supporting the adults who are raising them. I believe it's every family's right to have the opportunity to thrive, and every parent deserves the support to help make that possible. What gives me hope is that across Virginia, and of course the nation, we don't just see challenges, we see solutions. Every day we are reminded that strong families don't happen by accident. They happen when parents have the support they need, when communities choose to invest early and often, when policymakers, providers, and families work together towards a shared vision of what is possible. So let's ultimately build a nation where every family has the opportunity to thrive. Every parent has the support to help make that possible, and every child has the strongest possible start in life. Because the future we hope to build for our children begins with the way we choose to support families today. And the All-American Family Agenda is such a start. Thank you so much for your time, and I will pass it over to Birth in Color. Thank you.
Good morning. I'm Kenda Sutnell. I stand here today because families deserve more than promises. They deserve policies that honor their dignity, protect their freedom, and invest in their future. For too long, conversations about family values have been separated from conversations about reproductive freedom. But the truth is simple. You cannot claim to support families while denying the people the power to make decisions about their own bodies, their own health, their own futures. Reproductive freedom is family freedom. It is a freedom to decide if and when to become a parent. It is a freedom to decide to have a healthy pregnancy, to access health care, to raise children in a safe communities, and build a life with stability, opportunity, and hope. Every family deserves that freedom. That is why we are proud to stand here with Congresswoman Jennifer McClellan in support of All-American Family Act. This legislation recognizes what families across this nation already know. Strong families are built when government removes barriers instead of creating them. Families flourish when parents can afford child care, when children have access to health care, when workers earn living wages, and when every person has the freedom to make deeply personal decisions without political interference. Freedom is not selective. Justice is not conditional. If we believe every child deserves the chance to thrive, then we must also believe every parent deserves the resources and respect to raise that child with security. If we believe in healthy communities, then we must defend access to reproductive health care as an essential part of public health. If we believe in equality, then our laws must reflect that belief, not just in our words, but in our actions. This is more than legislation. This is about the woman deciding whether she is ready to start a family. It is a mother working 2 jobs who needs affordable child care. It is about the father who wants paid leave to welcome a new baby. It is about grandparents helping to raise the next generation. It is about every family that has ever struggled to make ends meet while only asking for a fair chance. These are not isolated issues. They are connected. Economic security, health care, reproductive freedom, child care, paid leave, equal opportunity. Together, they form the foundation of family well-being. We cannot build a stronger America by telling families they are on their own. We build a stronger America by ensuring every family has freedom, resources, and opportunities when they need to succeed. History has always moved forward because ordinary people demanded extraordinary courage from those elected to serve. Progress has never came from waiting. It comes from organizing, advocating, voting, and refusing to accept injustice as the inevitable. Today, we continue that work. We call on our colleagues, community leaders, and people across this nation to support the All-American Family Act. Because when families are free, our communities are stronger. And I will now pass it over to Doris Brown with National Medical Association.
Good morning. I am Dr. Doris Brown, representing the National Medical Association's current president, Dr. Roger Mitchell, and bringing you greetings from Dr. Mitchell. The National Medical Association, the oldest professional organization in this country of African American providers, believes that the health of our nation begins with the health of our families. And Congresswoman Jennifer McClellan All-American Family Agenda reflects a strong commitment to improving maternal health, protecting access to quality health care, and addressing the social conditions that shape health outcomes. And we are strongly supportive of that. You have already heard about how the family is the center of this country, and having a strong family includes not only the related social and political structures that support those families, and whether the person is going to have care in the prenatal, so you look at the continuum of care before a woman gets pregnant. There are things that she's going to need to be supportive, such as fertility assistance. Sometimes that might include in vivo fertilization and other areas. And then, of course, when that person becomes pregnant, they have to have prenatal care. Access to quality health care is vitally important, and certainly important for those brown and black members of the community that are sort of denied this. It is important to have insurance to gain access. And so that is all in the All-American Family Agenda. And as a healthcare provider, the National Medical Association and its members know that healthy families build healthy communities. And healthy communities build a stronger America. We commend Congresswoman McClellan for advancing policies that invest in the well-being of families in all of those areas that I've spoken about, and moving our nation closer to achieving health equity and health care justice for all. Thank you. I'll pass this on.
Yep, that's me. Thank you. Thank you so much, Dr. Brown. My name is Katie Baker, and I am the Virginia State Director for Protect Our Care. Thank you so much to Congresswoman McClellan for inviting us to join you today in discussing how this all-American agenda will address the affordability crisis for families both in the Commonwealth and across the country. Protect Our Care is a national advocacy organization dedicated to protecting and expanding access to high-quality, affordable health care. Our work has become even more urgent in this past year since Republicans in Congress cut over $1 trillion in health care funding to pay for tax handouts for billionaires like Jeff Bezos and trillionaires like Elon Musk. And it's sad we even have to say trillionaires when so many families across Virginia are living paycheck to paycheck. Thankfully, we can find a better path forward a path where families can afford to have health insurance, especially after Republicans in Congress gutted the Affordable Care Act and Medicaid to line the pockets of the ultra wealthy. And we're particularly excited about the aspects of your All-American Family agenda that will lower health care costs, including by expanding the big success of the Inflation Reduction Act's annual cap on out-of-pocket prescription drug costs. I wanted to speak a bit about how good policies can actually help people if they have the political will to get across the finish line, as we saw happened with the Inflation Reduction Act. And I wanted to share the story of Fairfax resident Irvin Varconi. He wanted to join us today. He's actually out of state visiting family. But thanks to the Inflation Reduction Act's $2,100 annual cap on prescription drug costs, Irv is saving up to $12,000 a year and is investing those savings in his children and his grandchildren, including in their college funds. These savings are making a real difference in Irv's life and in his family's life because he's passing those savings down to the next generation. But the Inflation Reduction Act only applied to that $2,000 out of cap only applied to folks who are on Medicare, and seniors are not the only people who face prescription drug costs. And that's why we're so happy to see that your plan would extend that cap to hardworking people with private insurance, so that everyone who is spending an ungodly amount of money on prescription drug costs can instead put that money back into their families like Irv has. And also happy to see that your plan includes a provision to make contraception more affordable by setting clearer standards for insurance coverage for this vital form of health care that will allow people to start families when they are ready. And I want to share the story of Janica Fernandez of Chesterfield County, who you've met before, Congresswoman. She also wanted to be here today. Janica relies on contraception to manage the debilitating symptoms of fibroids. And even after insurance, a 3-month supply of the pills can cost her nearly $500. That's money that she could better spend on her kids or put into her small family-owned business. And all insurance plans, whether public or private, should fully fund contraception. So as our country reflects on this past 250 years, we at Protect Our Care are recommitting ourselves to fighting for and alongside people like Irv and Janica and all families who would greatly benefit from the All-American Family Agenda's plans to make healthcare more affordable. So thank you to Congresswoman McClellan for being one of our strongest healthcare champions here on Capitol Hill and for continuing to partner with us as we fight to protect and strengthen access to healthcare. And now I'll turn it back to the Congresswoman. Thank you so much.
Thank you. Well, let me close out where I began. 250 years ago, in the Declaration of Independence, the Continental Congress recognized that all people are created equal and endowed by their Creator with the inalienable rights of life, liberty, and the pursuit of happiness, and that governments are created by, of, and for the people to secure those rights. 250 years later, we recognize that those principles apply to everyone, and the struggle of our country has been making sure that they do. But the pursuit of happiness cannot happen if you don't have the support you need to start a family and help it thrive. Access to life, liberty, and the pursuit of happiness can't happen in a country where we have the worst maternal mortality rates of any other industrialized nation and the worst infant mortality rates of any other industrialized nation. Those rights cannot be secured if the fundamental parental right of deciding when, whether, and how to become a parent is not your decision, but is left up to politicians to decide what they think is best for you. Life, liberty, and the pursuit of happiness cannot be secured when families struggle after the child is born to feed them, to provide care, to provide an education, to provide a home. And it cannot happen if older members of the family are left to struggle without access to care, or family members who want to care for them being unable to do so while feeding their family. That's what the All-American Family Agenda is about. It is recognizing that while government may govern in silos, people don't live in silos. It recognizes the interconnectedness of all issues and how they impact American families. And it recognizes that American families come in all shapes and sizes and all forms, and not just the narrow view that the Heritage Foundation of what defines a family. The All-American Agenda recognizes all kinds of families. So I want to thank you all for coming and braving this heat. I'm happy to answer any questions or if we want to talk one-on-one, but thank you all very much for coming. All right, any questions? All right, thank you.